This graph projects global mortality for non-communicable diseases. By 2050, they will cause an estimated 75.5 million deaths annually. But fracturing this data by age reveals a different threat: a steep, aggressive spike in metabolic failure among young adults. Medical researchers are tracking a surge in youth-onset type 2 diabetes and early-onset colorectal cancer in patients well under the age of 50. Pathologies traditionally understood as late-stage, age-dependent conditions are now appearing decades ahead of schedule. The mainstream public health narrative usually offers a simple, comforting explanation: human discipline has failed. We blame modern convenience, point to kids staring at screens, and assume a sudden global epidemic of laziness is driving the decline. If human willpower is failing across dozens of distinct cultures and every age demographic at the exact same moment, the cause is no longer internal. We are looking at a carefully engineered systemic trap. To understand how this trap functions, we have to look closely at what modern ultra-processed foods, or UPFs, actually do inside the body. For years, public health campaigns criticized these items simply as empty calories. Clinical research now shows they are highly complex, biologically active delivery systems. They act as biological Trojan horses. They carry endocrine-disrupting chemicals, compounds that migrate from industrial processing equipment and plastic packaging into the food itself. Once ingested, these chemicals act as false signals. They hijack human cells, interfere with hormonal regulation, and prompt abnormal fat storage. Then there is the microbiome. The artificial emulsifiers and stabilizers engineered into UPFs disrupt the natural bacterial balance in the digestive tract. This triggers intestinal permeability, literally causing the gut lining to leak, which floods the system with undigested molecules and creates a state of chronic, low-grade inflammation. When adolescents are continuously exposed to this kind of inflammatory environment, it causes profound epigenetic reprogramming. The chemical cues in the food alter how their genes express themselves, activating latent genetic vulnerabilities to cancer and metabolic disease that might not fully manifest until decades later. This dietary attack is compounded by behavioral shifts. Sedentary screen time displaces physical activity, which rapidly degrades cardiorespiratory fitness. This lack of movement initiates physiological changes in skeletal muscle, actively suppressing the enzymes needed to clear fat from the bloodstream and severely lowering glucose tolerance. The modern environment weaponizes our own genetic survival mechanisms against the host. We know the biological mechanisms are harmful, so the obvious question is why populations continue to eat this way. The answer comes down to cold economics. According to the United Nations, nearly 1/3 of the global population, 2.6 billion people, cannot afford to buy a healthy diet. Ultra-processed foods are, on average, 47% cheaper than fresh alternatives. For families on a constrained budget, UPFs are the most economically rational choice available. But this stark disparity isn't natural. Governments heavily subsidized commodity crops, keeping UPF production costs near zero. These manufactured foods boast almost indefinite shelf lives. They require zero refrigeration during global transit and are produced at a vast industrial scale. Fresh produce, by contrast, is highly perishable and incurs substantial labor and cold chain transport costs. Blaming a global health crisis on individual dietary choices ignores the macroeconomic reality. The global economic architecture actively subsidizes, physically distributes, and financially incentivizes the consumption of toxic food. The world's healthiest societies prioritize supportive, default systemic design over continuous individual effort. These nations achieve high metrics of health-adjusted life expectancy by engineering well-being into the structure of daily life. In Norway, healthy behavior is embedded directly into national law. They have a statutory right called Friluftsliv, or free air life, which guarantees public access to roam across uncultivated land. This culturally integrates low-intensity, sustained cardiovascular activity and green space exposure into normative daily life. Japan tackles dietary deterioration through a legally mandated program called Shokuiku. Nutritional literacy is institutionalized directly into the national school lunch program. Students actively appreciate raw ingredients, learn about macronutrients, and physically serve the meals, building durable dietary habits that last into adulthood. Singapore approaches public health through urban engineering. The government uses high taxation and quotas to make private vehicle ownership prohibitively expensive, while heavily subsidizing an incredibly efficient public transit network. They structured the physical environment to make walking the default mode of transportation. Engineered longevity relies on physical environments and cultural frameworks that make healthy living the path of least resistance. This diagram illustrates a critical shift in healthcare economics, modeled by Singapore's Healthier SG initiative. The traditional fee-for-service model inherently profits from treating sickness. Singapore switched to a capitation system, where doctors receive a predetermined fixed fee to manage a patient over their entire lifespan. The medical system only becomes profitable when it keeps the population healthy and out of expensive acute care hospitals. We also have empirical proof that aggressive point-of-sale regulation works. Chile implemented a strict law of food labeling, requiring prominent black stop sign warning labels on foods high in sugar, sodium, and saturated fats. Crucially, they legally banned these products from being marketed to children. The result was a substantial, immediate decline in the purchase of sugar-laden beverages and snacks. Today, much of the conversation has shifted toward the emergence of GLP-1 receptor agonists, like semaglutide. While they are effective for clinical obesity management, they introduce a significant moral hazard. Relying on a pharmaceutical bypass to override metabolic damage threatens to eliminate the political pressure needed to reform the food industry. The metabolic apocalypse we are facing is a forensic, engineered reality. Averting it requires us to abandon extreme dietary paranoia and recognize that pharmaceutical interventions are only clinical band-aids. The only sustainable defense against metabolic decline is an aggressive, structural redesign of the global food and health systems.